So the thing that's very exciting about the new essentials is that we had stakeholder involvement as they were being developed. And that can't be understated, that the public and our employers need to understand what a entry-level graduate of nursing schools is competent in, what they're prepared to do, how they're prepared to give care. So that really can't be understated. The other thing that it allowed for us to do at the University of Maryland was to do a reset on our curriculum to include things like wellness and resilience, some of the palliative care content we had identified as a gap. We were able to add electives for Gen Z learners, which is something that is very exciting for the faculty and for the students. Just a lot of things that we saw in the essentials that were missing in our current curriculum, we were able to add those. Now, the time that someone is in nursing school is still the same amount of time. We're a 2+2 program, and there is a lot of content creep, content compression, more things that nurses need to know. So we were able to really look at what, they can't possibly learn just the things that come out of our mouths. We have to think about other ways that students are learning and engaging, and so it's a great opportunity for that as well. We're doing a lot more engaged learning activities in the classroom than just the sage on the stage lecturing. At University of Maryland, we have completed our revision to reflect the new essentials, and that was an exciting process. I think for other schools of nursing, that would be my main point I would want to convey, is that it's really fun to do this kind of creative curriculum design, that it's not difficult. There are a lot of toolkits now available. We capitalized on our summer term. Our faculty are all on 12-month contracts, so they're available during the summer to us, and there's a little bit of a lighter teaching load. Fall and spring are our heavier semesters. So summer was really the time to get this work done. So in the summer of 2021, we had an all-volunteer faculty task force. And I would say that's sort of important too, that faculty who are excited and willing to do this work are the ones that you want to engage. It's difficult, I think, to work with the resistors. They're going to come along eventually because the work has to be done to stay accredited. So working with the willing is one of my leadership strategies that I find really useful, to work and engage those folk who want to do it. So in the summer we met twice weekly, so there was a lot of intense work, but we made it fun and relaxing as best we could. We were all on Zoom, so nobody was commuting. We allowed for people to take their scheduled vacations. We just said, keep up with the minutes, and we'd keep the work rolling with whoever showed up that day, twice a week. So we got the work done in a short amount of time, and I think there was some beauty in that, because instead of the work dragging out, I think it's very frustrating for people to sort of give their input, design things, and then for the work to sort of drag along. So we wrapped it up pretty quickly and started engaging our curriculum committee almost immediately to start looking at what we were doing. We revised our program outcomes to reflect the new essentials. We really looked at our mission and vision so that everything would align there. And then the curriculum committee, was very engaged. We had had a lot of faculty development in curriculum design. We had had a couple consultants come in. So we were in good position to get these moved quickly through, and then quickly got approval from the Maryland Higher Education Commission, our Maryland Board of Nursing, and we're waiting for our final approval from CCNE. Tools that I think were most helpful for us were the materials that are on the AACN website. I can't overstate that. It just gives you ideas about how other schools are doing it, things to think about. We saw gaps in our curriculum around systems. That domain is sort of a new idea for us. So we added our systems and informatics course. When we looked at the 4 spheres of care that AACN published, that was a really interesting idea for us because we had so many gaps around palliative and end-of-life care that we ended up creating a course in our program of study on palliative care. The piece about public and community health and the way that our students are going to demonstrate competency in increasing complexity and with different populations is really one of the cornerstones of our new curriculum. Our faculty feel very strongly that a Maryland graduate, a nurse who is a Maryland nurse, is going to reflect social justice, be educated in anti-racism, really understand the social determinants of health and the things that give less than optimal care in our institutions. So if they graduate educated in understanding how patients receive care and what our institutions can do, I think we're going to change the future of nursing care in the country as we change the future of nursing education. So we are fortunate to be at an academic health center where we have very strong practice partnerships, particularly with the University of Maryland Medical System. And we have a close relationship with Lisa Rowan, who is the CNO. She is the overseer of 12 hospitals in Maryland. And so we have been able to develop, we ran 2 pilots last spring where we are helping with their staffing crisis, and we are really changing the way we're educating nurses. So we're calling it the ACE program. It's the Academy of Clinical Essentials. And Lisa, Dr. Rowan, is paying clinical instructors who will have 4 of our students at a time, so that we didn't have any cost worry on our end on the education side. And those student nurses are working with an experienced nurse at UMS to care for 4 patients at a time. So they're taking a full patient assignment. So she didn't have the cost of a traveler or an agency nurse in that crisis staffing. So they took a lot of weekend and night shifts, things that weren't necessarily popular shifts with her nurses, relieved the burden at the hospital side, and gave our students wonderful experiences. They're doing 12-hour shifts on medical surgical units for the most part, some emergency department, but really good advanced kind of learning that we didn't have previously. So if there's a silver lining coming out of the COVID disaster in nurse staffing, it might be that we get some of these innovative models. The other pilot we ran last spring was called P3. We were really tight on getting enough practicum placements for our students who were about to graduate and they needed to do a practicum, shadowing a nurse, really working that nurse's shift. And so she provided a sort of handshake agreement where students could come in, get a practicum placement, and then have a job on that unit, with the thinking that they're going to need a far shorter orientation period than a nurse who's hired after graduation. So we're thinking, we don't have the data yet, it was done in a pilot phase, but we're waiting for that data to show that it really is going to be a win-win for the institution and for the education side for the students.